Hi, everybody. My name is Kirsten Bushner, and I'm an outreach specialist with the Fairfax County Health Department. I'm here today at Hybla Valley Elementary School with Family Liaison Extraordinaire Ana Amelunge. We have been working together since day one of the pandemic to support families, help them understand how they can stay safe from this pandemic. And Hybla Valley has agreed to host a vaccine clinic here today, and so we're going to be talking a little bit with Ana about how all that came about. So do you remember how we've been working together? Tell us a little bit about how this whole idea of having a clinic at Hybla Valley came about.
Okay, thank you, Kirsten, for inviting me to be with Facebook Live and be able to share and say a big word of thank you to all the great community and people and organizations and the health department for supporting our school families. Um, Everything started, as a shock to everybody when we found out that we were going to be basically on shutdown. And one of the biggest concerns for us as a school and as a community was how are our families going to be able to feed themselves if they're not working? How are the children going to be able to access medical care when most of them are uninsured? And so in the beginning of the pandemic, it was a great effort within the school community, the staff, family, and friends of the staff, neighbors in the Hybla Valley area, and also local churches, nonprofits, for example, real estate companies, attorney firms. We had the health department reaching out to be able to start food markets for our families. And so with all those donations, we were able to pass out food bags in the beginning, weekly, bi-weekly, to be able to send food home for our children, for our school children. And then after that, the second part of the pandemic, it was the great concern of, we had the second round of COVID coming in, and a lot of our families started to get more sick, lose family members, and it was a medical crisis there to be able to get COVID testing, to find funeral services for their families, and also get medical attention, because by this time we had gone into the pandemic for about a year and a half already, and now our families needed like special medical care or dental care, simple things as getting a pair of eyeglasses for their children. And so it was a group effort within the community and all these entities coming together to network and close those gaps and be able to reach out to each other among schools, churches, health department, local people, and nonprofits to find all these resources and make it accessible up to walking distance also, because most of our families don't drive, or they have very limited resources to be able to go out and tap into community resources. Yeah.
That's wonderful. I mean, this is why for us at the health department, it's so incredible to be able to collaborate with folks such as yourself. You're very connected to your community. You know all of the different organizations in the area, all of the different people who can pull together their assets and their resources to support our neighbors and our friends. And that's what community health is all about. So we're very grateful for this opportunity to continue working together. And I know that we've, as a family liaison, your job really is to serve as a bridge between school and home. And, when kids and families, when their well-being is taken care of, then that helps them to do better in school, right? They can achieve the most that they can achieve at school when they're feeling good, when they're healthy, when they have their basic needs taken care of. So you also touched on something very important, and that is, of course, that the pandemic has been very long and difficult for everybody. And you touched a little bit on some of the health needs. Can you tell us a story maybe about some of the health needs that you saw in the last couple of years specific?
Yes, I can date back to almost right before the pandemic, and it happens also now at times more constantly than before, post-pandemic, where we have special needs within the medical needs of our families, the children, the parents. And one story that sticks out is we had a family whose one of their sons had a kidney failure, and so at that time they were having to pay $60 to find a ride to take them to Fairfax to get dialysis because we didn't have a dialysis center here near the Route 1 corridor. And it was very challenging, but with the help of our school social worker and tapping into what was around the area, finally, dialysis center opened up on Route 1. And so that made it easier for this family to have the treatment for this student. Now he's in, this is a very success story. It's very rewarding to hear that he's doing great. He just got his first kidney transplant.
Wow.
He's going to West Potomac High School in the area. So that's thanks to the community and the school reach out to work along with private and local services for our families.
Okay. So for our viewers, just in case you're hearing some ambient noise, it's because the clinic folks are coming in to set up now. We're here in the cafeteria of Hybla Valley Elementary School. They're setting up. So pardon the noise. It's all good noise because we're waiting for our 50 families that came the first time. Is that what you had told me before?
Yes, about 3 weeks ago.
We had about 50
Yes.
folks come and get
Yes, adult
vaccinated.
and children. Yes, and the great thing is that I always tell our parents, if I'm able to reach out to 20, then to me that's like it triples because I know those 20 parents will tell another 20 and another 20, and that's how we build community and the right information goes out.
And because that's another reason that we're so grateful to be working with you and other family liaisons in the health district, is that you all are very much trusted members of the community. The families know that the information you're going to give them is the correct information. It's reliable, it's trustworthy. And so we really cannot do this work without people like you.
Thank you.
So it's really great to be able to collaborate.
Yes, to work together as a team. Yes.
Yeah, exactly. So let me see. Are there any other stories that you might like to share about how you help families? Maybe another example of how you've had a health impact, because after all, we're here from the health department and we are talking about the well-being of students and families. Do you have any other stories to share?
Oh goodness, there's a lot of little stories, I guess, that are great success stories within the medical part. One of the greatest things is being able to see our parents be able to navigate the system. It's very challenging at times because of the cultural differences, the language barrier, and when we have the public service part and the private sector come in and the nonprofit, it really eases and breaks down those barriers of culture and language, and it breaks the ice for families, for parents to be able to navigate the system on their own. That's what I share with the school staff when we began this school year, that one of the great things that came out of the pandemic was that a lot of our parents were able to, because of the high need that they had and their critical circumstances at home of just being able to meet the basics of having a roof over their head, food on the table, medical attention, it helped them overcome those language barriers and navigate the system. Yeah.
So sorry everyone about the noise. Maybe we'll take a break and take some questions and then we'll continue our conversation.
Yes.
Does anybody have any questions out there? How can people help support students? How can a regular person help support our students and families in their particular area?
In their area. So wherever they are, within Virginia, within their county, within their community, their neighborhood, they can reach out to the local central offices of their county and ask what are the schools that are in the highest need for basic things like food, like clothes. Some families during this time have had to transition because of COVID. They lost their jobs. They've had to relocate. They're still relocating, and they need furniture, just diapers, just the basic needs that any family needs. And so they can reach out to the central offices within their county. They can also reach out to the local schools that are near their home. And for example, in Fairfax County Public Schools, we have a foundation. And it's great that we have this opportunity to let folks know that if they want to make a special donation, please be assured that that will go directly to the families, to the students, to the needs of the school community. And so that's one way of the many ways they can reach out and help.
Excellent. I know that food donations are something that we always get requests for, and food and good nutrition is a cornerstone of good health. So did you want to add a few final thoughts about the type of food maybe that people might be able to donate?
Yes. So within what's most families in this area, for example, like the fresh fruits, the fresh vegetables, but at the same time, there's cultural foods. And feel free to reach out to your local social worker in the school community or the family liaison. Or counselors, and they will share with you what communities of ethnicity are within the school system, so they could, purchase foods that children will eat at home every night.
Okay, excellent. Well, thank you so much for spending time with us today.
Thank you,
I
Kristen,
see that
for
the
this opportunity.
vaccinators are getting ready.
Yes.
And I'm sorry, I didn't mean to cut you off. It's wonderful to spend time with you, talking a little bit about this collaborative effort, community coming together to support this incredibly huge public health effort.
Thank you. And a big thank you, Kirsten, on behalf of High Bluff Valley Elementary School and our school families and our school community, and the neighboring families. Thank you for everyone who supported them during the pandemic, in the private sector and the nonprofit and local government. It made a huge difference in the lives of every child, within High Bluff Valley.
Excellent. Thank you so much. So I'll just close out by saying, again, thank you for tuning in. And if you need more information about COVID, you can check out our website at fairfaxcounty.gov/COVID-19. Thanks so much.
Thanks.